Hello, and welcome to Just Say It, the podcast that turns beginners into confident English speakers. Each episode brings you real-life conversations, repeat after me practice, and fun cultural tips. Ready to speak up? Let's dive in.
Imagine for a moment you find yourself in an unfamiliar country. You're feeling unwell, maybe you got this persistent cough, or just a strange ache you can't quite place. You need to talk to a doctor. Or maybe you're just at home trying to figure out complex medical instructions in English for yourself, or maybe for a family member. It's so easy to feel overwhelmed, isn't it? Especially when your health is on the line and every word seems to carry so much weight.
Absolutely. It feels like a high-pressure situation.
But it really doesn't have to be. Today, we're going to do an essential exploration, really looking into mastering English communication for all sorts of medical situations.
Yeah, from understanding your doctor's advice confidently to navigating a full-blown emergency.
Exactly.
Right.
This discussion is designed to, equip you with the words and, just as importantly, the confidence you need.
And what's really fascinating here is how our sources, we looked at practical YouTube guides, phrase books, some quite detailed medical articles. They don't just focus on what words to use. It's more the profound why behind being understood and understanding others, especially in a medical context. It brings up a really key question, doesn't it? How can we move beyond just knowing a few phrases to being truly prepared when our health is paramount?
And communication feels like the biggest hurdle sometimes.
Precisely. So our mission with this exploration is to kind of pull out the most important nuggets of knowledge from these different resources, give you a shortcut to being well-informed and genuinely prepared.
It's about empowering you, really, helping you take an active, informed role in your own health journey.
Exactly.
And that crucial confidence, it actually starts even before you step foot inside a clinic or, an emergency room. It really begins with those foundational steps. So let's kick things off with what seems like the most basic step, but honestly, it's often overlooked, making the appointment. That initial phone call, it isn't just a formality, is it? It's your first real opportunity to establish clear communication. It really sets the tone for the whole visit.
Yeah, absolutely. You need to introduce yourself clearly, concisely, and state your purpose. Think of it like your opening line.
All right.
So, for instance, if you're scheduling a routine checkup, you could say something like, "Hi, my name is Olivia Bargo, and I would like to schedule my annual doctor appointment for my medication." See, name. Clear objective.
Right. Straight to the point.
Or, if you're feeling unwell and need something more immediate, directness is even more key. "Hi, I am Mark Mitchell. I am sick today and I need to see a doctor."
That direct approach makes sure the person on the other end gets the urgency, right, again, and routes your call properly.
Exactly. It's about being efficient from the very first word.
Okay, that makes perfect sense. And building on that, specifying who you want to see and why, that must be incredibly helpful for the clinic staff, too.
Oh, definitely. It's crucial for continuity of care, especially if you have an ongoing condition or, a specific doctor you usually see.
So you might say something like,
You could say, "I would like to make an annual appointment with Dr. Smith so I can get a physical completed." Or if you're already a patient but have a new issue, maybe be more specific. "I am a patient of Dr. Jones, and I have a sore throat and a fever today."
Okay. So that helps the office staff streamline things, making sure you get scheduled with the right person, maybe someone who already knows your history.
Or someone who can deal with your immediate problem, yeah. Now, once you've stated your purpose, you should be ready for some administrative questions. They're pretty standard, necessary for the clinic.
Like what sort of things?
They might ask, "What type of insurance do you have?" or "Has your address changed?" Pretty standard stuff. Another common one, especially if your preferred doctor isn't free right away, might be, "Are you okay seeing a different doctor or maybe a nurse practitioner?"
Right. Anticipating those can make the call feel smoother, less stressful.
Definitely. Reduces any hesitation you might feel about giving out personal details.
But just as important as answering their questions are the crucial questions you need to ask. This isn't just a one-way street, is it? Your understanding is absolutely key for a smooth visit.
Couldn't agree more.
So if anything is unclear, don't hesitate. Speak up. Like, for example, always confirm, "What time am I supposed to be there?" Because a simple mix-up about the time could mean a missed appointment.
So true. And beyond the time, logistical clarity is just as vital. Always ask, "Do I need to bring anything with me?"
Good one. Like insurance cards or maybe old medical records.
Exactly. Or, as we'll talk about in a bit, that crucial medication list. It's a common pitfall patients arriving unprepared, and that can delay things.
Okay. And what else?
Well, if it's a big medical center or somewhere new, ask, do I need to go someplace special? Especially if the clinic has multiple sites or your appointment's in a specific department within a hospital.
Ah, right. Asking those questions proactively saves a lot of stress and running around on the day.
Absolutely.
It sounds incredibly simple, but that initial call really does set the tone, doesn't it? Getting those basic logistical details ironed out can just dramatically cut down stress later on. And speaking of reducing stress, our sources really emphasize confirming the details before you hang up.
Yes, this is key.
After you've gathered all the info, it's a really good idea to write it down and then repeat it back to the person. Something simple like, so, just to confirm, I will see you tomorrow at Dr. Mendez's office at 10:30 a.m., right?
Exactly. That simple step can catch potential misunderstandings right away. It's not about distrusting them. It's about ensuring mutual accuracy. Everyone's on the same page.
So why is it so critical, though? Confirming these details that seem maybe minor, especially if you feel rushed or a bit nervous on the call?
Well, it raises an important point. It's crucial because a misunderstanding early on, like the wrong time or the wrong building, can snowball into bigger problems.
Like delaying care or just causing massive frustration.
Exactly. Or even missing a really critical appointment altogether. It's about building that foundation of clarity from your very first interaction. It reinforces that accuracy matters. Even for just booking an appointment, it's a proactive step in managing your health.
Absolutely. And that foundation of being prepared, it extends right up to the moment you walk through the clinic doors.
Right.
Our sources highlight something critical.
Yeah.
Bringing a comprehensive list of your medications and knowing and stating explicitly any allergies you have.
And when we say comprehensive, we mean everything.
Not just what the doctor prescribed, right?
No, absolutely not. It includes over-the-counter drugs you buy yourself, any home remedies you might be using, herbal medications, even things that seem harmless like special teas or natural supplements. All your vitamins and any weight gain or loss products, shakes, pills, bars, whatever.
Why is that so important? I mean, a vitamin seems pretty harmless.
Well, this comprehensive approach is vital because, fascinatingly, many seemingly harmless over-the-counter things or herbal remedies can actually have significant, sometimes dangerous interactions with prescribed medications.
Really?
Oh, yeah. Or they can even skew the results of diagnostic tests. For example, did you know that a common herbal supplement, St. John's wort, can seriously reduce how well common heart medications work or even birth control?
Wow, had no idea.
Or that taking high doses of vitamin C can actually mess with certain urine tests, potentially leading to a misdiagnosis. Our sources really stress that these seemingly small additions to your routine are crucial puzzle pieces for your doctor. They need the full picture for your safety.
That makes sense. And allergies, too. It's not enough just to say, I have an allergy, is it?
No, definitely not. You have to explicitly mention any allergies you have and, crucially, describe the type of reaction or the side effects you get.
So, like, is it a mild rash or severe swelling?
Yeah.
Or trouble breathing?
Exactly. That detailed information is critical for your safety. Certain reactions can be life-threatening, or they can significantly limit the treatment options your doctor can safely consider. It empowers your doctor to make truly informed decisions, avoiding potential harm because they understand your body's sensitivities.
Okay, so you've got your medication list, your allergy details. What else helps transform the appointment? Our sources mentioned preparing questions.
Yes, this is huge. Thinking ahead about your questions transforms the appointment from, a passive experience where you just listen into an active one.
It's like preparing for a high-stakes interview, but for your own health.
Exactly. And if we connect this to the bigger picture, preparing these questions isn't just about getting answers, it's about shifting the whole dynamic.
How so?
It encourages a partnership with your healthcare provider. You become an informed participant in your own care, not just someone things happen to. This collaborative approach really leads to better outcomes.
Okay, so let's get practical. What kind of questions should you think about preparing? Maybe starting with symptoms or diagnosis?
Good place to start. You could ask things like, what exactly is this disease or condition? How serious is it? And how will it affect my life, home and work? That practical impact is key.
Right. And maybe, what's the prognosis? Short-term and long-term.
Definitely. What can you realistically expect? Also, what caused this? And a really insightful one is there more than one condition that could be causing these symptoms?
That shows you're thinking critically, pushes for a thorough diagnosis.
Exactly. And still on the diagnostic side, you should ask, What symptoms should I watch out for? Helps you monitor yourself. How can I be tested, and what will these tests actually tell me? Understanding the why behind tests is important.
Yeah, avoids feeling like you're just being poked and prodded randomly.
Right. Also, when will I get the results? And will I need more tests? Practical questions for managing expectations. And finally, do I need a follow-up visit? And when? And maybe, do I need to take precautions to avoid infecting others? Essential for your health and for others too.
Okay, that's diagnosis covered. What about when the conversation moves to treatment?
Equally important to be prepared. Ask, what are my treatment options? Plural. Opens the door to discussing alternatives, not just one recommendation.
And the practical stuff. How long will the treatment take? And crucially, what's the cost?
Very real concerns for many people. And to make sure you're making an informed choice, ask which treatment is most common for this, and is there a generic form available, and is it just as effective?
Good questions for understanding standard practice and potentially saving money without compromising care.
Precisely. And crucially, you need to understand the potential downsides and what happens if things don't go to plan. So always ask, what side effects can I expect? What are the risks and benefits associated with this treatment?
And to really understand your options, what would happen if I didn't have any treatment?
Yes, or what if I delay my treatment? These questions empower you to weigh the options thoroughly, considering the consequences of doing nothing or waiting.
Also vital, is there anything I should avoid while I'm on this treatment? What should I do if I do get side effects? And how will I know if the medication is actually working?
All key for managing things yourself and knowing when to seek help or adjust. And don't forget practicalities like, what should I do if I miss a dose? And will this affect my job or my lifestyle? Covers the day-to-day impact.
Okay, now what if surgery is on the table? That feels like a whole different level of questioning needed.
Absolutely. Given the significance of surgery, you need to be even more thorough. Start with the basics. Why exactly do I need surgery? What specific surgical procedure are you recommending? And critically, are there alternatives to surgery?
Make sure you've explored all the less invasive options first.
Exactly. And again, how much will surgery cost? Still a major concern.
Then beyond the why and the cost.
Delve into the procedure itself. What are the benefits and risks of this specific surgery? What happens if I don't have this surgery? And always, always ask, where can I get a second opinion?
A second opinion seems like a really good idea for something major like surgery.
Almost always. Gives you extra perspective, reassurance. Then practical things. What kind of anesthesia will I need? What are its risks? How long will it take me to recover fully?
And questions about the surgeon themselves.
Yes, for your peace of mind. What are your qualifications and your experience performing this specific surgery? Be specific. And how long will I likely be in the hospital afterwards? Being armed with answers to these transforms you into an active participant, not just someone passively undergoing a major procedure.
Okay, so now you're actually in the doctor's office. The way you describe your symptoms, as you said, it's like the doctor's roadmap to figuring out what's wrong.
Exactly.
It's not just saying it hurts. You need to paint a vivid picture with words. And knowing some key distinctions can make a huge difference in getting an accurate diagnosis.
Right. Doctors often start with those open-ended questions, don't they? How do you feel today? Or how are you feeling? Or just, is everything okay?
And the common response is, I'm fine. I feel sick. Not so good. Not very well. Or just, I'm sick. That initial exchange kind of sets the stage.
Then, once it's clear something's up, they'll likely try to pinpoint it more directly. What's the matter or what's wrong? And you can respond simply with, I have, or I've got, followed by the condition, I have a headache, I've got a sore throat.
Simple structure gets the basic point across.
But to really help your doctor, you need to go beyond just naming the general problem. You need to articulate your specific experience.
So, like with an allergy, it's not just saying I'm allergic to peanuts, but explaining the reaction, like hives or difficulty breathing.
Precisely. Or for asthma, how severe is the difficulty breathing? Is it mild, or do you feel like you can't catch your breath at all? Do you need your inhaler right now? These specifics paint a much clearer picture, guiding them to the right diagnosis or treatment.
What about more everyday things like a cold or a cough?
Same principle. With a cold, what bothers you most? Sneezing, blocked nose, sore throat. With a cough, is it dry, or are you coughing stuff up? Is it constant or intermittent? For diarrhea, how often? Has anything changed in your diet? An earache, sharp or dull pain? Constant or on and off? A fever, what was the highest temperature? Any chills or body aches with it? It's about contextualizing your specific experience.
Even for something common like a headache.
Absolutely. Is it a dull ache or a sharp pounding pain? Where exactly is it located? Heartburn? When does it happen? After meals? At night? A rash? Is it itchy? Painful? Both. Has it spread?
Okay, got it. Sore throat, is it hard to swallow? Stomachache, general pain, or specific cramping? It's all about the detail.
Exactly. Sprain? How did you twist it? How does the joint feel? Sunburn? How red is it? How painful? Toothache? Which tooth? Is the pain sharp, throbbing, sensitive to hot or cold? These details help differentiate between similar conditions.
And describing pain itself, that seems crucial. You mentioned the 110 scale earlier.
Yes, and the key is context. Don't just give a number. Say, my pain is a 6, and at this level it's hard to focus on work, I can't sleep well, and I really need medication to manage it.
Because a 6 for one person might feel like an 8 to someone else.
Exactly. Pain tolerance varies hugely. The context clarifies the functional impact, which is what doctors really need to understand for effective treatment.
That's such a critical tip, and you can get even more specific using words that describe the sensation of the pain, right? Like giving them different colors to paint the picture.
Precisely. Think about words like aching, that dull, continuous discomfort, burning hot, stinging, cramping tight, squeezing, dull, not sharp, hot like a high temperature, nauseating, makes you feel sick.
Okay, what else? Persistent, doesn't go away. Pinching sharp, squeezed, pulsing like a heartbeat, sharp, intense, piercing, shooting, travels quickly. Sore, tender to touch.
Keep going. Sporadic, comes and goes. Stabbing, like being poked. Tender, painful when touched. Tingling, prickling, or buzzing. Or throbbing, that rhythmic, pulsating pain. Each word gives a different quality, guiding the doctor.
And the location of the pain needs to be precise too.
Absolutely paramount. Don't just say, my head hurts. Be specific. Point if it helps. Visual cues are great. Use directional words. Lower, upper, under, over, left, right, on, in, inside.
So instead of my stomach hurts, maybe I have a sharp stabbing pain in my lower right abdomen.
Exactly. Or I have a persistent ache in my upper left arm and it radiates down towards my elbow. That level of detail helps pinpoint the issue much faster.
Now, you mentioned earlier there's a nuance between words like sick and ill, or ache and pain. Why is understanding these distinctions so important?
Because that level of precision can genuinely impact diagnosis and treatment. Let's clarify sick versus ill first. Sick is generally less formal, usually for short-term things like a cold or a cough.
Right, or feeling nauseous, like I feel sick to my stomach.
Exactly. And in British English, to be sick can also mean to vomit. Ill, on the other hand, is often used for more serious or chronic problems, think cancer or pneumonia, though it can describe short-term ones too. It feels a bit more formal.
And the nouns. Illness and sickness.
Illness usually refers to the specific medical condition or disease, like a serious illness. Sickness is broader, referring more to the state of being unwell or how you feel, like morning sickness. Understanding these helps you communicate accurately.
Okay, and what about ache versus pain? They get used interchangeably all the time.
They do, but the distinction is important for a doctor. An ache is typically described as a continuous, prolonged, dull discomfort, often a throbbing sensation covering a broader area. Sometimes you can almost ignore an ache, like a muscle ache after exercise.
Whereas pain.
Pain usually refers to physical suffering from illness or injury. It's typically a sharper, more intense sensation in a more specific part of the body. It hurts more intensely than an ache, demands your attention, hard to ignore.
So ache is generally dull and widespread. Pain is often sharp and localized.
That's a good summary. And knowing that difference helps your doctor understand the nature of your discomfort better.
Okay, so let's recap this bit. The way you describe symptoms is the doctor's roadmap. Paint a vivid picture, use precise words, understand these distinctions, give the full context. It's key. Now, once you've clearly described your symptoms, the next really crucial step is making sure you fully understand the doctor's instructions. And never, ever hesitate to ask for clarification.
Absolutely vital.
Doctors often use common instructions and terms, but even if your English is good, medical language can be really complex, right?
Yeah.
Very specific meanings.
Totally. They might say, take these pills twice a day, or apply this ointment every night. You'll hear terms like allergy, prescription, diagnosis, side effects. Grasping their precise meaning is fundamental. Your health depends on it.
But the importance of asking for clarification, you can't overstate that, can you?
No, you really can't. Our sources stress. Always ask for clarification if you don't understand something. There's often this perceived power dynamic or patient's fear looking unintelligent.
A common trap, isn't it? Just nodding along.
It is. But honestly, your health literally depends on understanding. Misunderstanding a dosage, a warning, how to do something is It can have serious consequences, even life-threatening ones. Your role is to be informed. Don't let embarrassment stop you.
That's such a vital point. So if the doctor's talking fast using jargon, it's easy to just nod? What's the best way to just hit pause and make sure you get it?
Right, that nodding along trap. Instead of just saying, I don't understand, which can feel a bit blunt, try phrasing it differently. Put the focus on the communication itself.
Like how?
You could say, could you rephrase that in simpler terms for me? Or, I want to make sure I've got this exactly right. Could you walk me through that again, maybe using an analogy? It's polite, but empowering. Shows you're committed to understanding.
What about repeating it back?
Excellent strategy, the teach-back method. You repeat the instructions in your own words. So if I understand correctly, I should take this before meals, twice a day, for 10 days, and call you if I feel dizzy.
And that lets the doctor catch any misunderstandings immediately.
Exactly. It confirms comprehension on both sides.
Okay, beyond just understanding the verbal instructions, grasping the details of prescriptions and medication itself is essential.
Yeah.
There are different types of prescriptions.
Yes, and knowing the distinctions helps manage your health and communication. First, there are repeat prescriptions. These are for long-term meds, like a statin tablet you take once a day.
Yeah.
The idea is the doctor knows roughly how long they should last. So you generally shouldn't request them more than maybe a week before they're due, unless you have a good reason, like you're going traveling.
So you need to communicate that travel plan before you run out.
Exactly.
Yeah.
Tell your doctor or pharmacy beforehand to avoid stress. Then there are variable use prescriptions.
Variable use.
For medications you don't necessarily use every single day or where the amount changes. Think eczema cream more during flare-ups, less when skin is clear. These offer more flexibility for when you request them based on your actual usage.
So you don't call for a refill until you actually need it. Makes sense.
Right. Saves everyone time. And finally, acute prescriptions. These are for one-off or short-term things like antibiotics for an infection or painkillers for a recent injury.
Okay.
They're also often used when starting a brand new medication that needs a review before long-term use to check for side effects. Any request for another acute prescription usually needs a clinical review first because they're not meant for ongoing, unchecked use.
So if you ask for more antibiotics, the doctor will likely want to see you or talk symptoms again first.
Exactly. To make sure continued use is appropriate and safe. What's fascinating here is how the system aims for safety and convenience, but needs your informed participation. Understanding repeat versus acute helps you manage meds effectively and communicate needs clearly.
It really isn't just take this pill anymore, is it? There's a whole system. And knowing the types helps, especially now things are mostly electronic.
True. And speaking of the system, there are other common terms worth knowing. Dosette boxes or nomads.
What are those?
Special organizational boxes, often from pharmacists, to help people with complex medication schedules or who forget doses. They separate each day's pills, usually in weekly batches. A great help for managing multiple meds. Something to ask about if you or a loved one struggles. Then there are controlled drugs. These are higher risk of substances, maybe with potential for abuse, even with legitimate medical uses. So there are stricter rules on prescribing and dispensing them for safety.
Meaning you might need ID to pick them up or need more frequent doctor visits?
Potentially, yes. If discussing these with a new doctor, be clear about your history. I've been on this controlled med for X years under Dr. So-and-so for condition. Helps ensure smooth care transition.
Okay. What about surgical appliances and devices? Sounds broad.
It is. Covers things applied externally, compression stockings, colostomy products, stoma products, often custom-made, supplied by specialist pharmacies usually. If prescribed one, find out where to get it, how to use it, how to get replacements.
And the electronic system itself, electronic prescribing or EPS.
That's the standard now, almost everywhere. Sends prescriptions directly to your chosen pharmacy, replacing paper scripts. It's a huge convenience. Chemists can check status. You can change chemists easily. Reduces calls to the GP surgery.
Much more efficient. But requires you have a nominated chemist.
Right. That's simply your usual preferred pharmacy where your electronic scripts go automatically. It's your choice. You can set up at the pharmacy. If your doctor doesn't have one for you, they'll ask. Ensure scripts go where you need them. Less hassle, less risk of lost paper scripts.
Okay, let's shift gears now to moments where every single second counts. Emergencies.
Critical topic.
In an emergency, clear, concise, immediate communication can literally save a life. It's not just what you say, but saying it instantly and clearly, cutting through any panic.
Absolutely. And that starts with knowing the crucial emergency numbers. In the USA and Canada, it's 911. In the UK, it's 999. Connects you straight to police, fire, ambulance.
And beyond just the numbers, those simple general alert phrases are powerful, aren't they?
Yeah. Incredibly so. Things like help, be careful, look out, or watch out, and please help me. They immediately alert people to danger or distress.
Even if you're in that unfamiliar country, maybe don't speak the language well, those cries for help are often understood universally.
Exactly. They draw attention instantly.
But it raises that question again. Under immense stress, maybe in a foreign place, how do you remember these phrases? It's easy to just freeze.
That's where practice, even mental rehearsal, comes in. It builds what you could call muscle memory for words.
So they come out when you need them, without thinking.
Kind of, yeah. Like a fire drill prepares you for evacuation. Mentally preparing these phrases readies you for that critical moment.
Okay, so let's get into specific medical emergency phrases when you're calling for help.
Clear and direct language is vital. Those first 10-15 seconds of the call are critical. State who you are, what the emergency is, where it is, and if the patient is conscious and breathing.
So things like,
call 911 immediately. I need medical help. There's an emergency address. Give the exact address. Someone is injured and unconscious. We require an ambulance for chest pain. Even just, where's the nearest hospital, conveys urgency and gets the ball rolling. Give the operator actionable info fast.
These phrases are like lifelines, aren't they? Condensing chaos into urgent, actionable requests for first responders.
Precisely. Think about someone collapsing, saying, the patient is unconscious and not breathing, immediately conveys the severity, guides the dispatcher.
Okay. And once you've made that initial contact, you need to describe the condition concisely.
Yes, simple, impactful sentences. I can't breathe. I'm experiencing severe chest pain. Other crucial ones. It's a critical situation. Send help quickly. An accident just occurred. Severe bleeding here. The patient is unconscious and unresponsive. Possible heart attack. Immediate assistance needed.
These give emergency services the key details they need to send the right help right. And paramedics arrive prepared.
Exactly. Or you might need to convey specific injuries. Burn injury, needs emergency care. Broken bones, unable to move. A child needs urgent care, severe head injury. Difficulty in breathing, lips turning blue.
For sudden collapse.
Sudden loss of consciousness, fell hard. Or simply, need a doctor right away, urgent medical attention required. These direct statements cut through ambiguity. In that high stress, remember, breathe, speak slowly, repeat info if asked.
While we're focused on medical, knowing a few phrases for other emergencies is useful too, especially when traveling.
Definitely helpful. For crime, stop, thief, or call the police. For fire, fire, call the fire brigade. Or maybe just asking others, can you smell burning?
And for other tricky situations.
Things like, I'm lost and need directions. I can't find my keys, passport, mobile. Or I've locked myself out of my car room and need a locksmith. Not medical, but being prepared helps navigate difficult situations confidently.
So what does all this mean for you, the patient? It means being prepared isn't just about understanding, it's about active participation, becoming your own best advocate.
Exactly. It's about ensuring your safety and getting the best possible care. Our sources really emphasize empowering yourself.
No.
Start by actively participating in all decisions about your treatment. Don't just passively accept. Engage. Ask questions. Share your preferences, your concerns. It's your body, your health, your decision.
And things like advanced directives.
Yeah, consider completing those if appropriate and give copies to your provider. Ensures your wishes are known if you can't communicate. Also, share any special care needs, cultural or religious considerations.
And if you feel overwhelmed during an appointment.
Don't hesitate to ask a trusted family member or friend to come with you. They can listen, take notes, advocate for you, provide extra support. Remember, you are the center of the healthcare team. Everyone should be working with you.
Another critical part of being active is just speaking up.
Absolutely. You have a fundamental right to question anyone involved in your care. Doctors, nurses, staff. We talked about writing questions down beforehand, which is great.
But don't limit yourself to the list.
No. If something comes up during the chat or you have a new concern, voice it. Don't let doubts linger. A question unasked can lead to misunderstandings.
And for basic safety, always make sure they identify you correctly.
Yes. Before any procedure, medication, even a sensitive talk, make sure they ask for your full name and birth date. It's a vital safety check. Don't hesitate to speak up, calmly but firmly, if you think they've got the wrong person. It prevents critical errors.
What about asking about procedures themselves?
Always. Before anything, even a simple blood draw, ask them to explain what they plan to do, why, and what you can expect. You have a right to understand. and related to safety.
Hand washing.
Yes, you can politely remind healthcare workers to wash their hands or use sanitizer before touching you. Might feel awkward, but it's crucial for preventing infections. A simple, powerful act of self-advocacy.
It's fascinating how all these tips together really shift things, doesn't it? From being a passive recipient to an empowered partner.
Exactly. It encourages critical thinking, shared decision-making, a proactive stance towards your well-being. That's what truly effective, patient-centered healthcare looks like. It builds trust and leads to better outcomes, giving you more control over your health story.
So we've explored quite a bit today how to navigate the English-speaking medical world more confidently, from scheduling appointments effectively and describing symptoms precisely.
To understanding complex prescriptions and knowing how to act decisively in emergencies.
And we've also really highlighted how empowering it is to take that active, informed role in your own care, making sure your voice is heard and understood every step of the way.
It makes you think, doesn't it? Consider just how empowering it is to clearly articulate your health needs. It's not just for your own well-being and peace of mind, but it contributes to the clarity and efficiency of the whole healthcare system. How might even a small, consistent improvement in your medical communication skills ripple out? How could it impact your overall sense of safety, control, maybe even your quality of life, well beyond the doctor's office?
That's a great final thought. This has been a really insightful exploration into something that affects us all, wherever we are. We sincerely hope you feel more confident and prepared for your next interaction with the medical world.
Remember, knowledge is most valuable when it's understood and actually applied. And when it comes to your health, truly every single word matters. Stay healthy and keep learning.
Great job today on Just Say It, where every phrase brings you closer to fluency. If you found this lesson helpful, click the bell to never miss an episode and leave a comment sharing your favorite tip. Until next time, keep practicing and just say it.